the Portex,
And
you have the Jackson, you have the Fenestrate, huh?
Jackson old, right? Like they still use that?
Yeah.
Vietnam.
They still make them.
Yeah, they still make them.
But who uses them?
What?
People who
People
have
that are
been
used to
on at home, and they need to have something in, but they don't need to be attached to a ventilator or anything like that. So, we looked at the infant ones. We looked at the trach button. Do you see the Passimure over there?
Can I ask you a question about the pediatric one? How would we suction if we had to then?
The size catheters. You have catheters that go down as small as a
They
tube.
are small.
They're all catheters that will fit down
okay.
this. Yes.
Oh God, that's so tiny.
Oh yeah,
Jillian,
we were
you
in
see the
NICU,
Passimure
we seen
over
that.
there?
26 French.
There's a whole box of them.
A whole box of
Yeah,
them.
when we were in the
Meaning
NICU,
so
they
they
had
have their own airway.
It was like just like a little hose. It looked like. And
Yeah.
it
No,
was
no
like,
storage.
They have suction catheters small enough to fit
I
down
didn't
there.
realize that.
Yeah.
if you did you make sure you
No.
saw it? Yeah, when we
26,
were there,
maybe
you seen them like suctioning.
We go this
No.
week.
Mary, what do we have left to do? Just extubation?
And oh gee, what time is it?
It's
We're gonna have
15.
Oh, we got plenty of
45
time.
minutes.
Yeah, we got plenty of time.
Did you put this in my pocket? She did. He did. I told him
Okay,
we were gonna kill
these are Passimures. It's simply a one-way valve. It fits. Does it fit on this thing? No, it doesn't fit on this thing. Has to go with the inner cannula, I guess. It actually fits right on there. The patient, it has a one-way valve, so the patient can inhale through here, but on exhalation, this valve closes. So the patient has to have a fenestrated trach in when you put one of these on, and it would be preferable that you also deflate the cuff, so that the patient can now breathe through the normal channels and they can also talk.
Well, the cup would be deflated anyway, wouldn't it?
Mm-hmm.
Because they're not getting positive pressure or ventilation. They're
You know, there is some school of thought that you should have a little bit of air in that cuff, especially if the patient's eating. If your patient's on a diet and they have a trach, there is some school of thought they should have a little bit of air in that cuff to just prevent aspiration. Remember, the patient with a tracheostomy can still eat, whereas the patient with an ET tube can't. They can eat, they can talk, they can do normal stuff.
So then the Passimure valve has to have the universal adapter also.
Oh, yeah. It has to fit over your 15 millimeter.
So
Here we
is it-
go.
So it's 22 millimeter then, right?
No.
It has to fit. Well, so what is it then?
What's 22?
What's the external?
The internal of the
The
Passimure would be the 15 because the inner is the 13 millimeter.
There are
It's the
some-
external of your manual resuscitator that's 22. Your manual resuscitator has an internal 15 so that it could
adapter.
fit on here, but external 22 so a lot of your masks can fit on the outside.
So that would be 15.
And while you're on
ET or
video,
trach
would you
is
anticipate
15.
a
Right.
female with a
Right.
7 or an ET tube?
The manual? A manual external
The
is 22.
BVS. I was kidding.
I'd like to know.
So the
Manual
mask will fit on
external
there.
adapter.
So she should
Yeah.
That's the 20.
She should throw that out.
Maybe they don't speak up.
Yeah, external on
I wasn't
trach or
confused
ET
until
tube.
that.
You
Yeah,
weren't
I wouldn't
confused